Today we will be doing the skill Foley catheter for a female patient. You will need your Foley catheter kit and you will need your ChlorPrep swabs that come separate. We cannot use the betadine swabs that come in the kit because of the fact they will stain the mannequins or your simulated body parts. So we will switch these out during the checkoff. Also, again, we're doing a female, and we have our bedside table, and we have our hand sanitizer, and I do have a trash can that you cannot see that's by my feet. So we'll go ahead and get started. But a knock. Hi, my name's Sarah. I'm going to be your nurse today. We are going to put in a Foley catheter, but before we do that, I need to identify who you are. What is your name? What is your date of birth? And what are you allergic to? Thank you. So today, again, we're going to be doing a Foley catheter. Have you ever had a Foley catheter done before? So you have some understanding about it. In your Foley catheter, it gives you this nice little card that talks about what a Foley catheter is. If you want to read through it, take that information. I'm going to leave this card for you. Then I'm going to wash my hands, help my patient get into position. And again, we would want to consider privacy, but for the checkoff purposes, we as instructors need to be able to see. So I am going to fully expose the patient. At this point, after I get my patient into position, I'm going to wash my hands, put on gloves, and do the first peri-care. This is where I take a warm washcloth and clean the outside of the labia to be prepared to do the next step. Once that's done, I remove my gloves, wash my hands, start in my Foley kit. I have the second cleaning. Put on my non-sterile gloves. Make a little mitt. I'm gonna open up the labia and clean down the middle between the labia. The next part is I'm gonna start my sterile field between my patient's legs. There is a shiny side and a dull side, and the shiny side goes down. And this is where your patient can help you lift their hips, and you would slide it underneath their hips. I have a hand sanitizer to wash my hands additionally. And this would be the point, if the medium sterile gloves do not work for you, you would need to switch them out with the ones that would fit you appropriately. My sterile field is now set up, but this is where I'm gonna stop and change out my ChlorPrep for the betadine, okay? Again, we know we'd not reach into our sterile field. We're doing that just because of the betadine will stain the mannequins. Wash my hands with the solution provided for me. Now that my sterile gloves are on, I can now get inside of my sterile kit. There is a fenestrated drape that's white. We will not be using that for the female. I'm gonna remove the Foley catheter adhesive because we do not need that at this point. I'm going to remove my cup because I do not need it. You have 2 syringes. The blue is your lubricant, and I'm going to put it down into my tray. The other one is the saline. That's going to inflate my balloon, and it goes into this green port. Your catheter protective sheet is perforated to help give you control. Now I'm going to make sure everything that is in my sterile kit that's going to be moved is in my tray and it's not sticking out so it won't hit my patient. I'm going to take this sterile tray and move it to my next sterile site between my patient's legs. The next thing is I have to decide which hand I'm going to touch with the labia to be able to expose the meatus. With that, once I touch my patient, this is now a non-sterile hand. Once it touches the labia and opens them up, we don't remove this hand. So as you can see, I am exposing the meatus. In cleaning with this, there are 3 swabs that we're going to clean with. It's a little bit different than what we just did with sterile field. Okay, we're going to clean away around the meatus, closest towards you around that meatus, and then last, we're going to clean right down the middle over the meatus. Get your Foley catheter out of the lubricant and insert it. And you're just gonna feed it in without touching the patient with your sterile hand. Once you get urine, you're gonna insert another 1 to 2 inches. You're gonna take now your unsterile hand, let go of the labia, and now hold your Foley catheter. You're going to take your saline and inject it and inflate the balloon. Then we're going to take our Foley and pull back until we meet resistance. That's seating that balloon into the bladder so urine doesn't leak out. At this time, you should have urine coming into your Foley catheter bag. The sterile procedure is now over, and we're going to take our Foley catheter bag and we're going to put it on a non-movable part of the bed and allow the urine to drain. Now we're ready to adhese the Foley catheter to the patient. demonstrating purposes, I'm gonna take my gloves off so you can see what I'm doing. If you are like, I don't know how this applies, there is instructions inside of the kit. You have 2 swabs. One is an alcohol. We're gonna use it first, and that is used here on the inside of the thigh just to clean off any oils or lotions on the patient's skin. The next one is what's called a sure prep. It's a tacky or a sticky adhesive to help the tape stick. I'm not gonna physically put that on the mannequin because it makes it difficult to take it off. Again, if you're not sure how to use this, there's also basic 1 through 4 steps on the back of your Foley catheter holder. So you're gonna take the port, it's a blue port that you use to get urine out of, through the hole. It velcros over. And you don't want to tape the Foley so tight against the patient that it doesn't have room to be able to pull and move if the patient moves their legs. So you don't want this tight like that. You want some looseness, okay? Now that that is adhesed, we're gonna take a rag and we're going to clean up our patient. We need to clean up the betadine off the skin because it can be irritating. And we wanna make sure that we clean off any extra jellies off of the catheter. Now we need to help get our patient into position of comfort. Provide for that privacy. Make sure their call light is in reach. We would wash our hands and document the skill.